Hello and happy Friday. This week I seem to have had a lot of patients that were interested in neck rejuvenation and specifically the skin of the neck, so I thought I would review some of those options that we have when we start talking about this difficult problem. Now I say it's difficult because truthfully our tools are limited and they are, I guess I'll call incomplete. And I say so because the neck skin is so much different than it is of our face. When we look at the neck skin, there's very little subcutaneous fat there, so the skin is inherently thinner. Whether it's the dermis or the epidermis, they're also thinner. We also have less adnexal structure in the neck, which means that there's less hair follicles and there are less sebaceous glands. And sebaceous glands are those glands that make sebum, which is that waxy substance that gives us protection or hydration. So without those, the skin of the neck is much more delicate and we have much more limited choice as far as what we can use to apply. What we can do to the face may simply be too aggressive for the neck to heal from. So when I have a patient come in for rejuvenation, and that is facial in general, for example, I usually talk about having 5 different buckets that we can pick from for our choice of treatment. We can talk about skincare, neurotoxins to relax the face, or in this case, the neck, fillers to help fill or plump or hydrate, surgery, and then rejuvenation with resurfacing, which is kind of the junk basket term of chem peels, lasers, and anything in that kind of category, so surface treatments. When we actually apply that thinking to the neck and go through those options, skincare obviously comes up first, and as it turns out right now, there are still different neck tightening treatments and creams that we use. I'm actually doing a trial right now of a split neck just to see how that goes. I'll let you know about it. I've got a different serum going on one side compared to the other. But those are things that do have value, and they are neck specific because again, we can't necessarily put on, let's say, Retin-A in the neck and have it still behave like it would be in the face. So we have to be more gentle with neck treatments. That's why neck skin elements, products are actually different than the face. Again, they're going to have some value. They're going to start pushing that needle towards improvement. The second treatment we talked about, neurotoxins, which are Botox, Dysport, and you can use them in a very light fashion, for example, across the muscle of the neck, and you can kind of span a large value or large area with light or small treatments to try to rejuvenate that skin. It's supposed to let that neck relax or that neck muscle relax, and therefore the skin will kind of release some of its resting tension lines. Also in patients who have a lot of those striated or areas of muscle that are kind of thickened, it helps to relax some of those as well. Again, somewhat limited in what's there. It does take a fair amount of product to do that. When we talk about fillers, that's where a lot of the interest has been recently. Now, we've been through periods where we've tried, let's say, dilute versions of hyaluronic acid, like things like Restylane and Juvederm, to try to fill the necklace lines, the horizontal lines of the neck. And the problem with that is they tend to show up. They can be a little lumpy even in the best of hands, or they can also get a little bit of that bluing quality they call a Tyndall effect when the actual material kind of changes the skin texture and translucency. So again, it's difficult to hit it right. What I always call the therapeutic window, meaning the area of getting it correct versus incorrect and overdone, is a little bit narrow. There's another soft tissue filler called Sculptra, which is more of a biostimulatory product that we can use in a hyperdilute fashion in the neck also to try to actually thicken the neck as well. And although that is also quite good at helping to thicken the neck, what happens is we're still not getting the surface fully improved. Essentially, we're thickening the skin, which has value. And as I said before, the skin is inherently thin. So it does have value in that sense, but the surface may still have that pebbly or that kind of crepe paper kind of quality to things. Surgery really doesn't have a lot of value here. And I say that as a surgeon because I do a lot of facelifts, but I'll be the first one to say, and I say this over and over and over again to my patients, surgery does not pull out a wrinkle. And whether you're in the neck or whether you're in the face and you pull on the face here, we're not pulling out some of these accordion lines. We're going to improve them a little bit for sure. In the neck, as we rejuvenate the neck and help out with the lines and the heaviness and maybe the muscle part that makes a neck lift valuable, it's not going to change the texture of the skin. It's just going to reposition where it is. So surgery really does not have a lot of value. Then the last treatment talks about resurfacing tools. And again, you can do light peels, for example. Those are safe to do in the neck. They are going to have some value, but they're going to have some limited value in there. You can actually push that up a little bit more and start getting into lasers. And in general, for the same amount of downtime, lasers are going to give you a little more rejuvenation in the wrinkle category as opposed to a chem peel. So lasers we use quite frequently in the neck, and you can do something that's kind of in that gentle version. That's really a fairly quick turnaround, something like Halo, which is by the Cyton company. We do that a great deal in the face, and then we include the neck as an area of treatment. That's a laser that punches little holes in the skin with a hybrid laser, essentially 2 lasers firing at once to help rejuvenate the skin in that setting. Or you can actually push that to the next level, which is called fractionated lasers. And you can use those lasers again to make little punctures in the skin to try to get that to rejuvenate. But again, there's limits to how we can do with that. I will also say that when we talk about other tools that are plug-in devices, things like radiofrequency devices or microneedling radiofrequency device, my office went through an experience with something called Morpheus. We had a really kind of a suboptimal result with all of that. We actually got rid of that machine. Didn't really work well for our patients. Ultrasound therapy called Ultherapy, plasma therapy, infrared, all of those are machines that are intending to tighten the skin and in theory would rejuvenate the neck. But I will just say from our experience, we haven't really seen anything that is reliably improved for the skin, or if it is, it doesn't do it comfortably, or it doesn't do it well enough to kind of basically justify the cost that it takes to do those things. So anyway, so neck skin itself is difficult. Oftentimes what we try to do is sample a little bit from all of these and try to get some synergy. Try to get a little something between the skincare and a topical treatment, or try to do something where we might do one of these injectables to see how that also can help. So if you're considering neck rejuvenation, come on and take a look. But the issue is that we're probably going to use something in a combination form, and quite frankly, it's going to be something that is going to be good, but it may not be complete.